Yeah, you know I can do this right now. Wait till you sit. That'll hit 15, don't worry. I'll wait till it hits 10, so I'm 10 seconds left. 5, 4. All that may come to my knowledge in the exercise of my profession, or outside of my profession, or in daily commerce with men, which ought not to be spread abroad, I will keep secret and never reveal. These words are from the Hippocratic Oath, which are recited by medical students at their graduation, just prior to them entering their careers as physicians. These specific words reinforce their duty of upholding confidentiality in the medical field. However, not all medical situations are the same. These new physicians may face difficult situations requiring difficult decisions to be made. Today, I will talk about how to manage patient confidentiality when others are at a potential risk. According to Jessica DeBoard at the University of Washington School of Medicine, there are two main reasons for wanting to uphold patient confidentiality. First, patients need to feel comfortable sharing sensitive information with their physicians. If they don't feel comfortable sharing this information, their quality of medical care may be compromised. Also, people in general need to feel comfortable seeking medical care when needed in the first place. I will now further discuss the problem of managing patient confidentiality, and then present two possible solutions and analyze both their strengths and weaknesses in order to determine which solution is more advantageous. So just how important is this problem of maintaining patient confidentiality? A study led by Perez-Carceles determines that about 95% of patients disclose sensitive information to family members, and about 1/3 disclose information to individuals in general, all without the proper and prior consent of the patient. So why would physicians breach confidentiality? According to the same study by Perez and Carceles, the most common reason is to inform those that are caring for and looking after the patient. A lot of times these are caregivers or family members. Another reason is that some people, according to physicians, have the right to this sensitive information based on their close family ties to the patient. A third reason physicians sometimes breach confidentiality is to calm any anxious or stressed family members or close individuals to the patient. So what would happen if this problem is not fixed? If individuals at risk are not informed, then that may facilitate the spread of contagious diseases. Also, it may hinder the patient-physician relationship, and as I mentioned before, that might make patients less willing to present sensitive information to their physician. It may also make people in general less willing to seek out medical care when needed. So what can be done? I will now present two possible solutions to this problem. The first solution is to always maintain confidentiality. By doing this, it would always uphold privacy at all times. There would be no exceptions, and this is an absolute solution. There would be no consideration for third-party individuals that are at risk. This is a quick fix, and physicians would just need to never breach confidentiality. The second solution would allow breaching to sometimes occur when needed, and there would be a medical ethics board to review each case individually. If no medical ethics board exists at a particular healthcare facility, one would need to be created and implemented. The one cost to this solution would be time if one medical ethics board is not already in place. Now I want to consider the strengths and drawbacks of both solutions in order to determine which one is more appropriate and advantageous. As a reminder, solution one provides that confidentiality is never to be breached. By allowing confidentiality to never be breached, it would uphold and maintain the strength of the physician-patient relationship. And since confidentiality is never breached, physicians and healthcare facilities would never run into legal issues concerning confidentiality breaches. The one huge drawback to solution one is that third-party individuals that are at a potential risk would never be notified, and they may be harmed. As a reminder, Solution 2 allows for the occasional breach of confidentiality when needed, and there's a medical ethics board to review each case. The huge strong point for Solution 2 is that it prevents harm to third-party individuals that are at risk. One drawback to Solution 2 is that physicians and healthcare facilities may encounter legal issues concerning confidentiality breaches, and it may also diminish the strength of the physician-patient relationship. Of these two solutions, the more appropriate and advantageous one is Solution 2. Yes, confidentiality is breached, but it is done so in a just manner. It prevents uninformed third-party individuals from being harmed. Also, Solution 2 calls for a medical ethics board, which ensures a non-abusive nature to confidentiality breaches. We've now reached the conclusion of this speech. I've discussed how to manage patient confidentiality when other individuals are at risk, its scope, and some of the major causes to this problem. I then presented two possible solutions and discussed both their strong points and drawbacks. I used this analysis to come to the conclusion of which solution is more appropriate, which was Solution 2. Solution 2 allows for the inclusion of safety and a higher level of ethics when navigating through a difficult medical dilemma. Are there any questions? Yes.
Hi, this is Dr. Al from the Cleveland Medical Center.
Sure.
Recently there's been cases with Ebola and with a lot of patients getting sick. Releasing that information not only damages the relationship with the patient who may have Ebola, but also threatens, the family members of this patient with Ebola. I remember many people local trying to hunt down the family members of the patient. According to your plan, is it safe to say, Ebola is a public safety hazard? Is it safe to announce to the public, who has Ebola and, which neighborhood should be quarantined, in fear that the patient's family might,
Sure.
get harmed?
Sure. Again, this is a drawback. Both solutions have drawbacks. There's not one solution that only has positive strong points, and so releasing that information the drawback would be the family members may be at risk for the public to perhaps harm them. But when you look at the greater scope of things, the public would know, and there would be no third-party individuals that would intentionally put themselves in the way of someone that they know has this highly contagious disease.
Okay.
Are there any further
I have
questions?
another question.
Sure.
As you know, being president, there is a need that the president needs to be able to serve his term, serve his duties. Now, if the president is unable, he must, resign, give position to, the next in command. Do you believe Americans should be allowed to question a president's health when there is some concern, asking to publicly release this information and potentially have him, leave from his position?
Sure. So you're questioning whether it is appropriate for the public to question.
Should if let's say Obama had some sort of medical condition, should he release
Disclose
it?
that.
Yeah. Do you think it's right for him to disclose it? Is that
Can
what
we
you're
have
asking?
the right to ask and force
Yeah.
him
Can we
to
say? Can you
disclose
please
it?
disclose it? Yeah.
Well, this specific thesis and problem deals with when third-party individuals are at risk for harm
Okay.
to their own health, and
Okay.
so unless he's encountering someone else, like in a skin-to-skin contact situation, it's not appropriate for the general public to question anyone's
Okay.
medical health.
So that's outside the scope
Alright.
of.
I
That's
see.
outside the scope of
Okay,
this
okay.
thesis.
Okay.
Yes.
Thank you.
Sure.
Thank you.
Any further questions? Well, thank you for taking
Yeah,
the time
thank
to
you.
listen in.
Well done.
Good. Time's perfect.
Yeah. Oh, perfect. Kenny's throwing the curveball.